When can patients sleep on the side of their joint replacement?
The question is, when can you sleep on the side? And I think this is mostly a question typically I get about hip replacements. And, I'll throw out the disclaimer that this is being an important thing to ask your specific surgeon because everyone's got a different preference. It may have a little bit to do with the approach that was used for the hip replacement, whether it was done, so-called from the front or the back. Only because while it's possible to have a dislocation, even though that's extremely rare, the position in which that may happen is slightly different for each approach. That being said, if that's not a concern, then I personally will usually say when it's comfortable to do so. I believe that patients will somewhat self-regulate, and if it's too early in the healing, a patient is probably not going to put too much pressure on the incision site. So I usually will take that approach, and it tends to be fairly accurate that patients kind of self-regulate.